Okay, so let's move on to the next organism. The next one we're going to talk about is Legionella. Legionella is going to be on your list of differentials for atypical pneumonia. All right? And there's a couple of unique features here I want to talk about for Legionella. Number one is it doesn't gram stain very well. Okay? So we'll say it's gram negative, but it stains pretty weak. A lot of the times with diagnosis for Legionella, that means you're going to have to do a fluorescent antibody test rather than use the gram stain as a confirmatory test. Okay? Now, they also require cysteine and iron. And remember, I told you one of the things that the organisms use to grow is this buffered charcoal yeast extract. Okay? Now, the last thing is, like we mentioned, with Pseudomonas, these also prefer the water, all right? And the unique thing, really, about Legionella is it's not human-to-human transmission. You get this from specifically inhaling the aerosolized water, all right? And we all know the story of the Legionnaires' convention, where they were having their convention, the organisms were in the air conditioning unit, and all of those persons that were at that convention that inhaled the bacteria got sick with what we now call Legionnaire's disease. All right, that's how the organism got its name. It's the first time we had really identified it. Okay, so the organism we're going to talk about is Legionella pneumophila. Again, it's going to be on your differential for atypical pneumonia. It is facultative intracellular. So again, what that means, you're going to get a granulomatous response. Reservoir, water, but really associated with water. And again, a transmission is from inhalation of those water droplets, the aerosolized water. Now, what are some of the predisposing factors for infection with Legionella pneumophila? I'm going to tell you that probably the most significant predisposing factor tends to be smokers, okay, generally over 55 years of age. So smoking, generally heavy smoking. They'll mention a significant smoking history in the vignette, and it's generally somebody that's upwards and over the age of 55. Usually they'll talk about someone in their 60s, more than likely. All right. Immunosuppressed patients, we know they're susceptible to a lot of the things we're talking about. Okay, but it's the smokers over the age of 55 that should be a clue for you to maybe start thinking about Legionella. Okay, pathogenesis is a facultative intracellular. So what's going to happen? Again, it's going to get in the macrophage. It does not get killed by the macrophage, so the macrophage seals it up in a granuloma. Okay, now the disease, there's actually two different types of disease presentations. Legionnaire's disease is the one that's going to be associated with the smoking history, the sixth decade of life for the most part, and again, inhalation of water droplets. It's not person-to-person spread, and it is an atypical pneumonia, okay? And along with that, you can also have mental confusion and diarrhea, although you will not be able to culture or to find the organism in the GI tract, all right? Now, I want to give you another example. We talked about the Legionnaire's convention. Another really good case where there was a little outbreak of Legionnaire's disease was an interesting case because mostly women, in this particular case, were coming down with Legionnaire's disease. And they traced it back to a grocery store where the organisms were in those mist machines that spray down the vegetables to try to keep everything fresh in the grocery store. So as the women were shopping, they were inhaling those water droplets, and they came down with Legionnaire's disease. Okay, so that just gives you another association to make with the inhalation of water. Now, if you look down here, Pontiac fever, if a young person were to come in contact with Legionella pneumophila, they probably would not get Legionnaire's disease. They would probably get Pontiac fever, which is basically just pneumonitis. All right, so they're not going to get pneumonia. There are typically no fatality rates associated with Pontiac fever, And untreated Legionella can actually, as far as Legionnaire's disease, have a pretty good high mortality rate, whereas in Pontiac fever, you're definitely not going to see that. And again, that also deals with the host factors as well. Diagnosis I mentioned already. I said gram stain is probably not going to be good because it doesn't gram stain very well. So the diagnostic test of choice here for Legionnaire's disease or Legionella pneumophila is the direct fluorescent antibody test. Okay. Now, you can also do serology looking for a 4-fold increase in the antibody titer specific to Legionella pneumophila. So those are some of the diagnostic features for Legionella. Treatment, you've got to consider for Legionella, you need a fluoroquinolone or azithromycin. You need something that can penetrate human cells. Remember, this is a facultative intracellular. Okay? How do we prevent Legionnaire's disease? We have to routinely decontaminate water cooling tanks. You could actually acquire Legionnaire's disease through a shower as you inhale those water droplets in the shower as well. So you definitely want to remember the association here with water, because in a respiratory disease, if they ask you what is the primary means of transmission, you're really going to tend to want to put person to person through respiratory droplets. But here's where they can easily ask you how it was spread, and in this case, it's by inhalation of the infected water droplets. Okay? So keep that one in mind for Legionella.